Welcome everybody to our monthly Cisne Forum, the Monterey County Immigrant Services Network of Empowerment. We are collaborative, formed by committee members. My name is Ina Donato from Natividad Medical Center, and I'd like to welcome each and every one of you. There is a virtual sign-in sheet in the chat box. Please feel free to fill out your information so we capture all of the attendees. This meeting will be recorded and can be distributed upon request. If for some reason you know of somebody who could not attend, kindly reach out to us and we'll be glad to send them the link. I'd like to start off by introducing our committee members who bring forth this meeting every month. Are we on the call? We'll start with Efrain, who's our techie.
Hey, good morning, everybody. My name is Efrain Magallanes. It's great to be here again to see you virtually. And I'm here representing the Migrant Education Program here at MCOE. Welcome.
Welcome, Efrain. Good morning.
Hi, good morning, everyone. I am Dr. Hortensia Jimenez. I am a sociology professor at Hartnell College. Thank you for joining us every month.
Welcome, welcome, Dr. Jimenez. Great to have you here. So good to see you. And Jill Hoffman from the American Red Cross is actually excused today. And we also have Melissa Raya from Natividad Medical Center, Managed Care Operations and Outreach. She's a health education assistant who is also excused today. And we all form the Cisne Collaborative. And today our topic is the Medi-Cal unwinding process. The Medi-Cal unwinding process, as you know, started again. And there's a lot of questions on, you know, who has to renew, when they have to renew, how is the process. So that is a hot topic in our community, especially after several years of not having to renew or report changes. So we have our guest speaker on the call, but before I introduce her, I would like to give this opportunity to any new Cisne members that would like to do their a quick introduction. Any new Cisne members that are attending for the first time, if you would like to introduce yourselves really quick, we have about 5 minutes we can dedicate to welcoming any new members to our Cisne Collaborative. I see Allison has her hand up. Allison?
Yes, hi. I'm Allison Henry Plotz. I'm in Seaside, California, and I'm actually here to cover for Jill Hoffman. And so I'm a volunteer with the Red Cross, and if there are any questions about restoring family links, then I can try to answer those, or I can take the information back to Jill. But I'm just really excited to be here. It's great to hear this. I actually worked for the Monterey County at Medi-Cal for a while in my earlier days. So this is kind of timely for me.
Welcome, welcome. Thank you for joining us. Thank you. And send Jill our warmest regards. Thank you. I see Marilu Quiroz has her hand up. Marilu?
Hi, my name is Marilu Quiroz. I am a program coordinator for Ventures. I mainly do financial education to people in our community. We're focusing right now on Santa Cruz County. We're doing a program called ALAS where we teach financial education and provide a monthly stipend. We're also planning on doing some workshops. So I would love to get in contact with some of you guys, and I'll pass it down to Celeste.
Welcome, Celeste. Welcome.
Hi, thank you. So my name is Celeste, and I am with the Alliance on Aging, and I am a Medicare counselor here with the High Cap program. I will also be attending the meeting today with my program manager. Her name is Elizabeth Corona, and she is running a couple minutes late, but she'll join very shortly.
Welcome, Celeste. Tiffany, May?
Hi, good morning, everybody. My name is Tiffany Morla. I'm a supervising public health nurse with Monterey County. I supervise the maternal, child, and adolescent health program. In the program, we do a lot of home visiting with pregnant women, parenting women, and children. I have a few of my public health nurses in the call with me today too.
Welcome and thank you for joining us, to you and your team. Are there any other new members that would like to introduce themselves? We have about 2 more minutes.
Hi, can I introduce myself? Sorry, I didn't know how to raise my hand actually on Zoom. Hi everyone, my name's Annette Aranda Aguayo, and I'm the Parent Involvement Coordinator for Salinas Union High School District. And I'm so excited to be here and get to meet more organizations as we provide a lot of services for our families. And we're actually working on planning our 13th annual Strengthening the Family Parent Conference, where we invite our families and we have workshops for them. So if anybody is part of an organization that would be interested in participating in this conference, please chat me or let me know, and I put my email on the sign-in sheet. Thank you, everyone.
Thank you. What date do you have for that event?
Our event would be Saturday, December 2nd from 8 a.m. to 3 p.m.
Wonderful. Thank you so much for sharing that wonderful information, and welcome to the Cisne Forum, Annette.
Thank you.
All righty. Any other new members to Cisne? I don't see any hands. Okay.
Not new, but if I can quickly do my spill of NAMI. We have NAMI class starting in Watsonville. It's NAMI Santa Cruz has a new office in in Watsonville. And we're trying to reach out to the Pajaro Valley families, because it's between the 2 counties, the Monterey County and the Santa Cruz County. So I am starting a class on September the 23rd in person in Watsonville, in the new office in Watsonville. NAMI Santa Cruz has a new office in Watsonville. So I'll send you the flyer, because we're looking for specifically, well, not specifically, it's open to anybody, but it's limited amount of people in the class, but mainly trying to reach out to the Pajaro Valley families. And I know that it was difficult to find a class there in the Pajaro Valley, because they're still under, construction and a lot of things, but the closest we can get was Watsonville. Okay, so I just wanted to let you know.
Thank you, Rosa, and welcome. Okay, so we will start to introduce our first guest speaker of the day. Yaneth, are you there?
I'm here. Good morning.
Good morning, Yaneth. So good to see you. Always a pleasure.
Good to see you too, Enith.
Okay, and please, the floor is all yours. You need to share your screen?
Yes, please.
Okay.
All right. I think you guys can see that. Awesome. All right. Well, good morning, everyone. Thank you so much for having me here this morning. It is a pleasure. My name is Yaneth Virgen Venegas. I am the outreach coordinator for the Community Benefits Branch. And today I do have some information regarding the Medi-Cal unwinding phase, some updates, and also some program changes that are scheduled to occur with the Medi-Cal program in 2024. So with that, I'll go ahead and get started. So today's objectives are to provide an understanding of the Medi-Cal recertification process, ways to submit recertification forms, and also the options to submit new Medi-Cal applications, as well as upcoming Medi-Cal changes in 2024. So the Medi-Cal unwinding. So I have a little bit of a background. So all Medi-Cal renewals were postponed from March 2020 to May 2023 as a result of the Families First Coronavirus Response Act continuous coverage requirement. And this occurred during the public health emergency. So counties have resumed processing Medi-Cal renewals effective April 1st for cases with a June 2023 renewal date. So currently Monterey County Department of Social Services provides Medi-Cal to approximately 198,427 residents. So currently, we have, like I mentioned, we have resumed the processing of Medi-Cal recertification process. And currently we do have some customers that are renewed automatically. These customers that are renewed automatically do receive a notice of action informing them that their eligibility has been renewed for a year. But approximately each month we do have 4,400 Medi-Cal cases that do not automatically renew. So for customers that do not automatically renew, they do receive a large yellow envelope in the mail with the Medi-Cal recertification form, and these packets are mailed 60 days before the renewal submit month. So recertification packets can be submitted via various ways. We have different options. We have the online option, the mail option, fax, or by phone. We also offer in person. We are fully open to the public. And so we do also offer an option to drop off documents at our Dropbox locations, which are located right outside our district offices. We have 3 district offices. We have one in Salinas, Seaside, and King City. So we do offer that option. So customers can expect reminders. System automated text and email notifications are sent when the renewal packet has been mailed out. We also send out notifications when the renewal packet has been received, and also when the renewal certification packet is incomplete. So incomplete can mean either we're missing information on the packet itself, or we're missing verification. And also they receive a notification when the renewal packet is processed. So in addition to that, the system will send 2 reminder notices a month prior to the renewal date when the renewal has not been received. So once the Medi-Cal renewal packet is received, we review it. The specialist, reviews the Medi-Cal recertification packet, reviews all the information that we have available on the case, and processes the information that they have available. If it's determined that the packet is incomplete, the eligibility specialist does make an attempt to collect the missing information over the phone. If the telephone attempt is unsuccessful, then a request for information is sent to the last known mailing address with a 30-day due date to provide the missing information. And so that's one of the reasons why DHCS launched a campaign to promote public awareness, to raise awareness about the return of the annual Medi-Cal redetermination process, to just ensure that the public was aware that, this was going to start up again. The most important thing was to really inform the public if you've had any changes in your contact information, to contact their human resources, human services department to update them with their current contact information so that we are able to communicate with them. That is really where we're at right now. And anytime we have a customer that calls in and indicates, I'm having trouble with my Medi-Cal, or my Medi-Cal isn't, eligible when I go to the doctor, a lot of times when we go into review, it's because we're missing information. And a lot of times it's because we don't have current contact information on file. So we're not able to communicate with them. So really important to just continue to remind the public to just ensure that their information is up to date with us. So if the customer does not provide the renewal packet or does not provide the requested information, they could be discontinued. If they are discontinued, the customer has 90 days after the discontinuance date to provide a complete annual renewal for a possible restoration of benefits. So they still have time. Organizations assisting customers with their Medi-Cal renewal packets with questions on how to complete forms can contact our outreach team. We are familiar with the forms. We can assist organizations with questions and also assist them with guiding on how to complete the forms. So I included a slide also for Medi-Cal applications with more information on how to submit applications and the processing timeframes. So new applications for Medi-Cal can take up to 45 days to process. Applications meeting emergency criteria are processed within 5 business days from the date that the emergency is discovered, if we have all of the information that is necessary to make an eligibility determination. So options to apply are online, over the phone, by fax, by mail, in person, or Dropbox locations are available as well. And also any supporting documentation can be uploaded online at dssupload.com. And we also offer assistance with completing applications. Our outreach phone number is here at the bottom, and that's the number to call in case anybody needs help with an application over the phone. The call center can also help, and that number is right up on top here under item 2, and that is also an option for over the phone. So upcoming Medi-Cal changes in 2024. So effective January 1st, 2024, a new law in California will allow adults ages 26 through 49 to qualify for full scope Medi-Cal, regardless of their immigration status. All other Medi-Cal eligibility rules, including income limits, will still apply. So this is part of the adult expansion, and this is coming very soon. Another change is also the elimination of asset limits. So also effective January 1st, the asset limits for all non-Magi programs will be eliminated. This includes long-term care and Medicare savings programs. And so community-based organizations, again, interested in uploading documents or submitting new Medi-Cal applications on behalf of the customers are encouraged to register for a BenefitsCal community-based organization account online at benefitscal.com. And I do have a very short, well, the video itself is pretty long, but I'm only going to let it play for about a minute or two for the purpose of this presentation. I'll be more than happy to share the link after the conclusion of our forum today with Enith, who can maybe share out with the group in case you guys want to just get a little bit more information on how to navigate through the dashboard. So I'll go ahead and share the video next. And I know that there's something that I have to do here to share my audio, so just give me a minute here while I set that up. And, all right, let me know if you can hear the video. Can you hear the video?
No audio.
No audio?
Janet.
Okay, so let me try again. Share sound. Let me know if you can hear
Welcome
it
to
now.
BenefitsCal, an easy
Good.
way to apply for and renew
Yes,
food,
no.
medical, and cash assistance benefits. This video will show community-based organizations the various features for CBO accounts. In this demo, we'll cover many topics for CBOs using BenefitsCal. This includes how to request access and log in, how to navigate the CBO dashboard, how to submit applications, how CBOs can upload documents, how to view reports, how to create referral campaigns, how to create and manage staff accounts, and finally, how to navigate the Help Center. So what is Benefits Cal? Benefits Cal is a new, simple way to apply for assistance and manage benefits such as food, medical, and cash assistance, all on one website that is accessible from any computer, tablet, or mobile device, all available in 20 languages. Community-based organizations or assisters can do several things on behalf of clients within Benefits Cal. They can submit applications, upload documents, check application statuses, view reports of activities, create referral campaigns, and create and manage staff accounts. There are two types of CBO accounts available on Benefits Cal: a CBO manager account and a CBO staff account. Both managers and staff can use Benefits Cal to apply for benefits, upload documents, and view reports of their applications. CBO managers can also view reports that include the activity of the staff in their organization. Managers can resume applications on behalf of another staff member, and managers can add or remove staff accounts within their organization. Let's review how to request access. Let's get started. Navigate to benefitscal.com. From the home page, click Login at the top right corner of the screen to get started. On the login screen, click Register your CBO account under Community-Based Organizations or CBOs. To request access, complete all the required fields. For the county, select the county where you assist the most clients. It's possible that you work in more than one county, and that's okay. Just select one for the form. Check the box to accept the terms and conditions. Then, click Register to submit your access request. The access request is on its way to the county. The county will review the request for access, and it may take a few days. Once approved, the county will create your account and send an email with instructions to get started. Here's an example of the email you'll receive. The email includes instructions to complete the account registration process, as well as the user ID and a link to complete the account registration. Click the link to continue. Enter a password for your Benefits Cal account. The password must be at least 8 characters long, have at least one letter, one number, and one special character. Re-enter the password. It must match. Then, click Save. After creating a password, log into Benefits Cal using your user ID and the password that was just created. Then click Login. Enter 3 security questions to help you recover your password in the future. Select a security question from the drop-down menu, then type the answers in the boxes provided. Then click Save. Finally, click to accept the Benefits Cal Terms of Use. Here's the
All right, so at this point, once the registration is complete, you will receive a welcome email from myself. And along with my welcome email, I do include all of these great videos, which really help get acquainted with Benefits Cal on how to navigate through the dashboard, just the different things that you could do within Benefits Cal. And in addition to that, you're added to my distribution list. So really any changes that are happening or any news that's coming from DSS is sent out to you via email. Or if we're having any community events or things like that, you're included in that distribution email. And also I am also available for any support with Benefits Cal questions or questions regarding any customer cases and so forth. And so, as I mentioned, this is a really great video. It does really it goes into a deep dive into like the dashboard, the different things that benefits users can utilize the online tool for, but the video is about 20 minutes long. And so I know we don't have enough time for that right now. I will be more than happy to share this video with Enid, who can share it with the group. And that is all I have for you today. Any questions?
Well, first of all, I'd like to say thank you, give you a round of applause. I know how extremely busy you are, and thank you for, giving us this opportunity to ask questions. And I'm sure there are a lot of questions. So I will ask our agencies to please raise your hands, and I will call upon you. So hopefully we can get as much questions answered today. So first here on the hand up, I see Rosa Gonzalez Rivas. Please state your question briefly.
So, when there's a family who's transferring from one county to another, how long does it take for them to transfer? Like I have a family who has Medi-Cal in Santa Clara, and they want to transfer it to Monterey County. How long does it take, and who do they go to first?
Great question. Thank you, Rosa, for your question. So the inter-county transfer process can take up to 45 days. And the way that the process works is the Medi-Cal beneficiary should report the move to the county where they're currently active. So in this case, your family would report the move to Santa Clara County. Then at that point, Santa Clara County will update their records and initiate the inter-county transfer to Monterey County. Once we receive the inter-county transfer, then we will go ahead and process that. And that process between the time that the sending county sends the information over to Monterey County can take up to 45 days.
Always report it to the county where their case is currently active. Start there, correct?
Correct, yes.
And then they can initiate the inter-county transfer.
Thank
Rosa,
you.
I know you work with a lot of mental health clients that need their cases changes right away to access mental health. Sometimes if you contact the ombudsman's office at the state, they can oftentimes expedite it or change it to a fee-for-service and then link them to a managed care plan and make it a fee-for-service. And after the meeting, you can reach me and I can give you that number. Okay, Rosa?
Thank you.
Thank you. And Rosa joins us from NAMI, the National Alliance for Mental Health chapter here in Monterey County. Okay, are there any other hands or any other questions for Yaneth? I know you mentioned that the packets are mailed to their last known address, kind of tying into Rosa's question, what if they've moved or failed to report the change? How can they go about requesting a new packet? And you stated even if they didn't submit it on time, there's a grace period. That grace period is 60 or 90 days to reinstate benefits?
90 days.
90, and they can go back and reinstate them without a lapse, correct?
A lapse, that is correct, yes.
After the 90 days, they have to reapply.
Correct.
Wonderful.
Right.
Where can they get packet duplicates?
So for Monterey County, they can contact us via phone, over the phone, or in person. I will share the flyer with the 5 options to contact the department, but to request a new packet, it would be over the phone or in person.
You did mention almost 200,000 people in Monterey County currently have active benefits. So that is a lot of families that this will impact. So if you currently work with families and are navigating how to renew their benefits, there is a flyer, there's a there's a question in the chat box if you can share the 5 ways to apply flyer. I put in the copy that you had provided me with.
Yes.
So that's still, the contact information is still valid. The website is still valid. So feel free to make copies for the agencies on the call and share that with your clients. Any other questions for Yaneth regarding the renewal or the expansion or the asset limit removal? Okay. I see we have 62 participants on the call. If you have any questions or need additional information, Yaneth has, been a wonderful resource for many agencies. If you are interested in having an agency training for your staff on how to, create a CBO portal or how to complete the forms, please reach out to Yaneth Venegas, who is the coordinator for the outreach branch of the community benefits. I see Alejandra Valadez has a question, and that'll be our last question. We go on to our next speaker.
Good morning, everybody. I was just looking at the chat, and there's something that's asking if she can explain more about the changes in the elimination of the assets.
Yes. So the elimination of the asset limits, as I mentioned, will occur on January 1st. And this will apply for all non-Magi programs. So these are the non-Magi Medi-Cal is basically any program that uses other rules to count property, household income, and size to see if people qualify. So there are different programs. This could be any program for like our aged, blind, or disabled population. And so the changes will apply to those programs. At this time right now, I don't have any more information regarding these upcoming changes. This is really all of the information that's been provided to me so far. What I may be recommending is maybe a little later in the year, maybe before January, we can schedule another presentation when we have a little bit more information available to kind of go over it a little more.
Okay. Definitely, I like that idea. So you can reach out to me once you have that information, and we can, try to squeeze you in as a speaker, definitely. And you're always welcome to join us to give program updates. We always allow enough time at the end. Anytime you're welcome to join us. We meet the first Thursday of every month from 8:30 to 10. And, nuestra casa es tu casa. Our home is your home. So thank you. So that wraps up Yaneth's presentation. Thank you so much, Yaneth. I sincerely thank you on behalf of the Cisne committee for being here today and sharing your wealth of knowledge. Thank you. Round of applause for Yaneth.
Thank you so much. Thank you so much for having me. Have a good day, everyone.
Okay. And our next speaker of today is Nancy Majewski. A little bit of history on Nancy Majewski. 27 years ago, I was only 5 then, 5 years old. I swear I was only 5. Nancy Majewski interviewed me, and I started off in the business office as a collector of all things. And it's been a pleasure to work with Nancy ever since. So it is my pleasure to introduce to you today Nancy Majewski, Director of Managed Care Operations.
Thanks, Enid. And I want to thank Enid and Efren and Dr. Jimenez on all you do for Cisne, and to the entire group, because you reach out to a widespread community with good information. So thank you. I was asked to talk today about the Esperanza Care program of Monterey County. It started in 2015 as a pilot project for the uninsured. It was for the remaining uninsured who were not eligible for Medi-Cal or full scope Medi-Cal. It started with the health department providing $500,000 and provided primary care in their clinics. And then lab and x-ray or diagnostic imaging services were available at Natividad. And then some pharmaceuticals were available at Walgreens. And then in October of 2017, in conjunction with the Monterey County Board of Supervisors, the Health Department, and Natividad, we developed the Esperanza Care program. It started with $2 million allocated from the Natividad budget. It covered 2,500 members. They are eligible if they are a resident of Monterey County and under 138% of the federal poverty level. And if they did not qualify for full scope Medi-Cal, they didn't have any other insurance. Also, it was for anybody aged 19 and above. That changed later to age 26 and above when full scope Medi-Cal became available for people under the age of 26. And then it changed in May of last year to only be eligible for age 26 to 49, because everybody outside of that range became eligible for full scope Medi-Cal. Again, the primary care is offered through the health department clinics, and they are eligible for lab, diagnostic imaging, specialty care, and diabetes education at Natividad. And then eligible for prescriptions to be filled at Walgreens. And then it was a one-page self-attestation from people. That was the application. And the program is administered by Pacific Health Alliance. And then in April of 2018, the program expanded from 2,500 to 3,500 eligible enrollees. And then in July of 2021, we added another 1,000. So since July 2021, we have had about 4,500 enrollees. The primary diagnoses for this group are hypertension, diabetes, and immunization management. And more than 50% of them are female. Since October of 2017 through June of next year, Natividad will have spent $16 million on this program. The program is slated to end December 31st of this year, when all residents of California under 138% of the federal poverty level will be eligible for full scope Medi-Cal. There will be a transition period over the next few months. Pacific Health Alliance is sending letters to all of the enrollees, advising them to apply for Medi-Cal. They can apply now, and then in January, it will roll over to full scope Medi-Cal, but until January, it'll be limited Medi-Cal. And they can still stay on the Esperanza program until they roll over to full scope Medi-Cal. So Pacific Health Alliance is sending letters advising enrollees. Natividad will be sending letters to our patients that fall in that age range, advising them to apply for full scope Medi-Cal also. And then at Natividad, under Enid's direction, we have financial counselors who assist with Medi-Cal applications and also assist with covered California applications. And for challenging issues, they can troubleshoot problems with transfers, documentation, all kinds. Enid and her staff are well versed in dealing with those kinds of issues. Are there any questions?
Any questions for Nancy Majewski? Thank you, Nancy, for your presentation. Very informative. If anyone has questions regarding the Esperanza Care enrollment, they would have to contact Pacific Health Alliance at 1-800-533-4742, and I can put that in the chat box. Any questions regarding letters they might receive or the transition into Medi-Cal, they will be getting letters, all of the participants. And right now, we are close to capacity, right, Nancy?
Yes, we have about 4,200 enrollees.
About 4,200. There's not a wait list, but we're near capacity. Okay. Thank you for your wonderful presentation. Any questions for Nancy regarding this Esperanza Care, what it covers, how to access, the cost? Okay.
Thank you.
Thank you for joining us, Nancy. Thank you so much. So let me put the Pacific Health Alliance for those of you that are joining us by phone. That's 1-800-533-4742. And that is for Esperanza Care Program. And they must access a Monterey County Health Department clinic, any one of their participating clinics, which is Seaside, Marina, Family Practice, Internal Medicine, any one of those clinics, they can see a primary care doctor and be treated. Their prescriptions must be filled at Walgreens, participating Walgreens, and x-rays, labs, and specialty care with a referral from their doctor can be treated here at Natividad at no cost. Okay, so with that said, now we have time on our agenda for any announcements, general agency announcements, or if anybody has anything new, any community events that are coming up, any updates that anyone, please raise your hand and I would be happy to call upon you. Let's see. Oh, thank you. Thank you, Rosa. Okay, Alejandra Valadez, you have an update?
Good morning. I'm Alejandra Valadez Garcia. I am a parent and community liaison with Migrant Education. I just wanted to announce this service is not from Migrant Ed, but there is going to be, it's called Adelante con Orgullo Mujer Hispana. This is a conference. ACOMI, yes, thank you. So yeah, this is a conference. It's happening in Gonzales from 8 to 3 on Saturday, October 21st. And I'm looking for Angelica's phone number. I think she's part of the planning committee, but
I can share that if you want. Angelica, yes, Angelica Chavez is actually with the Monterey County Health Department. She's a chronic disease prevention coordinator for the planning, evaluation, and policy unit. If you are an agency and want to participate in their health and wellness fair or have a booth, her number is 831-755 4514. Once again, 831-755-4154. Thank you for sharing, Alejandra.
Sure, no problem. Thank you.
Lisa McGrath has an update.
Yes, thank you. Good morning. I wanted to announce that we do have our 2 upcoming Walk to End Alzheimer events. One is Saturday, September 23rd in Aptos, and the other is on Saturday, October 7th in Monterey. And then we do have a 10 warning signs of Alzheimer's talk happening at the Hub in Salinas on October 11th. And we are joining forces with the Del Mar Caregiving Resource Center to have a virtual talk on healthy living for your brain and body on October 17th. And I can go ahead and send flyers for all of those to the email. Thank you.
Thank you for joining us, Lisa. Allison, you have your hand up. Allison, the floor is yours.
Yes, hi. Jill just wanted me to make sure that I announced a little bit about restoring family links through the Red Cross. I'm not sure how many folks are aware that it also includes migrants. So if you have clients that have suffered through natural disaster, conflicts in their country, and that might be the reason that they're migrating or immigrating, then they can contact the Red Cross, the National Red Cross. And there's a website. Let me see if I have that. Yes, it's familylinks.icrc.org for anybody that might be looking for missing family members. So I'll put that in the chat. It's a confidential program, and there's a caseworker that's assigned to each case. So that caseworker will do the tracing, try to locate that missing family member, and then of course contact the rest of the family that's requested the search. And then it's up to the family whether or not they contact or try to contact that individual. The Red Cross will also help with making contact with that missing family member when they're found. So again, that's Restoring Family Links through the National Red Cross chapter. Also, of course, the ICRC and the Red Crescent will assist in this project, this program. So I'll put that link in the chat. And then if there are any questions, I can certainly try to answer them, or I will take them back for Jill. And again, you can check that website too for more information.
Thank you, Allison. I see Anna Mendoza has her hand up. Anna, welcome.
Yes.
Good morning. Buenos dias.
Buenos dias. Hello, everyone. My name is Ana Mendoza, and I am the ESL Program Specialist for Salinas Adult School. I am going to take over your screen for a little bit just to show you our flyer. So we have an open house coming up September the 28th, which is going to be in a couple of weeks. We are going to have it in the morning and the evening. All the schools in Monterey, all the adult schools in Monterey County will be participating. Here at Salinas, we are, of course, as well. And in the morning, students and their families, or guests from the community, they can join us. And the food bank will be helping us by distributing some fruits and vegetables. And in the evening, there's going to be a warm meal for free, of course, for all our students or community members who are going to join us. And so I just wanted to, if you could help us promote it. I have placed a link on the chat box. And if you have any questions, please feel free to reach out. I also wanted to, I know many of you already received an email stating that we are currently having presentations available here on campus. At every presentation, we have around 35 students that come to listen to the presentation or more. And so therefore, we are being pretty successful with the presentation. So I'll be sending out an email. And if not, please reach out to me so that way you can come present. We have it available for 45 minutes on Wednesday from 10:30 to 11:15. If you want to come and present about your agency and inform our students about what's going on. We are trying to move on this presentation online, so it can be on our social media platforms, but we are not quite there yet. But I know we don't have any openings for this semester, but we do have openings for next semester if anyone is interested. And that's it. Thank you so much.
Thank you, Ana. Thank you, Maria. Maria, thank you for patiently waiting. Maria Echeverria, you have an update? Welcome and good morning. Buenos dias. I can't hear you. Put your audio on. There you go. Thank you.
All right. Thank you so much. And buenos dias. Good morning to everyone. So our agency with Special Kids Connect, we are actually having via Zoom workshops for parents. So our next workshop coming up, it's on a Tuesday, September 26th from 5:30 to 7 p.m. And this is on the topic of SSI for adults ages 18 and up. And this is to support families in understanding the supplemental security income eligibility application process and how to appeal an SSI decision for an adult who is age 18 and older. So the presenter for this workshop is from the Disability Rights of California. And anybody that's interested in attending can do so by registering online. We also have another one coming up, and that's on Thursday. I want to say Thursday, October 26th. And this is also understanding what is the SSDI, which is the Security Supplement Disability Income as well, for families to understand that process of eligibility also. And then we have Play, Connect, and Grow. And so our agency tries to go back and forth from Soledad to Salinas, offering this free activity, which is hands-on educational, which it's an open invite for all families that have a relationship with the child. And this one's coming up on a Friday, September 22nd from 10 to 11:30 in Soledad. So next month, we'll be back here in Salinas at Al Gabiland Library. And so the activity is focused on all the developmental areas of a child's growth. And also they provide diapers at the end of this session. We also have like this different mom's night out or couples night out. It's coming up with a chef that will provide all the foods and hands-on opportunity for the couples to come and meet with each other. They exchange information as well regarding the services that their children either receiving or how to navigate a system. Noche Para Mamá is also another outlet for all moms to come together, where they also have the opportunities to interact, exchange information about how to navigate also systems as well. And Noche de Mamá will be happening, the next one is in Soledad. So we also try to bring Noche de Mamá from Soledad to Salinas or Monterey or what have you. So this time around, it's going to be Noche de Loteria. So just for you all to know a little bit about the work that we do, we work with families that have a family member or a child with disabilities. So thank you for the opportunity of the announcements. Have a great day, everyone.
Have a great day, Maria. Thank you for sharing. And if you have clients or families that have special needs, children or family members, please reach out to Maria. They have a wealth of resources, activities and events for those families. Elizabeth Corona from the Alliance on Aging, welcome. The floor is yours. Thank you for joining. Buenos dias.
Hi. Good morning, everyone. So I'm with the Medicare Counseling Program, and we have two presentations here at our hub here on 236 Monterey Street in Salinas. They're Medicare basic, so anyone who is just turning 65 or is just getting onto Medicare due to disability, this is a great presentation for them to know what their options are for Monterey County. And we're having a English one on Thursday, September 28th at 5:30 p.m. and a Spanish one on Tuesday, September 26th at 5:30 p.m. So I can share the flyer in the chat box, or I can also send it over to you in need. And then I did also want to let everyone know that the annual enrollment period is coming soon. It's starting on October 15th to December 7th. So if you do have any clients that have Medicare, if they are starting to ask you questions about prescription coverage, you can always send them our way. Or if you have any Medi-Cal beneficiaries who might qualify for Medicare and they want to know a little bit more information about like the Medi-Cal unwinding or the prescription drug plan coverage, then feel free to send them our way, and I can share my contact information in the chat box as well.
Please do so. I do see a question in the chat box by Susana Zendejas asking what the Medicare Savings Program is. So please connect with Elizabeth Corona with the Alliance on Aging, Susana, and she can explain that in detail and also give you flyers on where to refer your clients to make appointments for one-on-one. And you are still doing Zoom or in-person meetings, Elizabeth? I know due to the pandemic, you guys were doing Zoom. Are you doing kind of both, or how are those appointments working now?
So we do offer in-person appointments. We have our office here in Salinas, and we do have an office in Monterey. And right now, currently, I'm having 2 volunteers that will be off-site at the Meals on Wheels in Pacific Grove and the Carmel Foundation. So that way, if they have any clients that are in those areas that can't travel to Salinas, then we can refer them to them. And we do in-person, telephone, and Zoom appointments.
Wonderful. Thank you, Elizabeth. And I see Marilu has been patiently waiting. Thank you, Marilu. The floor is yours, and welcome again.
Thank you, Enid. Yeah, my name is Marilu Quiroz. I work for Ventures. I'm a program coordinator, and we do a monthly workshop called Salud Financiera, where it's virtual as well through Zoom, and people learn about budgets, savings, credit, debt, a little bit of everything. We invite all communities members that are Spanish speaking from Santa Cruz County, Monterey County, San Benito County. I'll add the flyer to the chat. We also want to start a workshop about credit, where people could learn a bit more about credit and credit reports and credit scores and all of that. I hope you guys could pass this down to people in your programs or people who are interested in our workshops. I'll add them to the chat. Thank you very much, Enid.
Thank you, Marilu. And Lisa McGrath, your hand is still up. Did you have something else to say, or is it just up from the previous updates?
No, sorry, I forgot to take it down.
Okay, all righty. All righty. Is there anyone else who would like to give any program updates or any information sharing? I see Alma Mandujano. Alma.
Hi,
welcome.
good morning, everyone. Can you hear me okay?
Yes, we can. Welcome.
Good morning. So I just
Good
want to give
morning.
a quick announcement. I work at Natividad Medical Center in the Managed Care Department. We do community outreach, and there will be an upcoming event. This will be Seaside's Oaxaca by the Sea event. Feel free to join us. We will be tabling out there and giving away Natividad goodies, as well as some information from the hospital. The event will be on Saturday, September 23rd, and this will be from 12 to 5 p.m. Again, this will be in Seaside. If there's any organizations that are interested in perhaps seeing if tabling options are available, I can go ahead and send my email address, and you can follow up and see if they're still allowing for tabling options. So again, Saturday, September 23rd, Oaxaca by the Sea in Seaside.
Thank you so much for sharing that, Alma, and always so grateful for all you do for our community and getting all the programs out there. Thank you, Alma. We have Marcy Delgado. Welcome. Good morning.
Yes. Good morning, everyone. Mercy Delgado here with Field Institute. We offer free classes for 18 and older that wants to get their high school diploma. I just want to make an announcement that we still doing enrollments for new students. If you have anybody, or if you know of anybody that's trying to get their high school diploma, please send them over my way. And that's about it. Thank you for the opportunity.
Okay. Wow, we have a lot of updates. We have busy agencies, so much information. Thank you all so much. And for those of you that said you have flyers, I see you do have them available in the chat, but also feel free to send them to Efrain, to myself, or to the Monterey Cisne email or Gmail, and we'll be happy to share them through that platform as well for those that could not attend today. If you have not yet signed in to our virtual sign-in sheet, please do so now to make sure you get all these updates of these wonderful events and resources. The link is in the chat. Now I would like to go ahead and give this opportunity to anyone to recommend our topic for next month's. Every month we try to bring relevant resources and speakers of information that will be relevant to your daily work. So we really want to make your time valuable and bring you information that you can use. What topics are you hearing, or what type of speakers would you like to hear about for next month meeting? Please mark your calendars for the next the next month's meeting will be held October the 5th, which is the first Thursday of October, from 8:30 to 10. Please mark your calendars. And if you can raise your hand with any recommended topics for next month's topic in October. Anybody would like to recommend or have a speaker in mind they would like to hear more about? Dr. Hortensia said she has to go. She has a class. She has to prepare for a class. She is a professor at Hartnell College. So thank you for joining us, Hortensia. We value your time, and thank you so much for joining us. Is there anyone else who would like to give a topic of recommendation for the month of October? Rosa, I see your hand up, Rosa.
Hola, buenos días.
Buenos
Again, I think that I'm always trying to think ahead. And I think it's the month donde es el Día de los Muertos al final del mes. And so, you know, talking about grief, you know, I think that it's something that would be recommended, is to have someone who can come in and talk about the grief. I know that I'm hearing still families coming from different areas that are going through, you know, a lot of trauma. And so either something related to the grief, or you know, family counseling or something like that, because I think the month of October is when I think that, you know, focusing on Dia de los Muertos, and, you know, anyways, that's an idea.
Thank you for sharing, Rosa. We value your feedback. Any other recommendations or things you're hearing from your families or clients that you serve? You know, we try to bring real resources that you could have at your fingertips when those questions do arise. Oftentimes you're helping them, you know, with the need, and then the family opens up to you and they have other needs. Is there any other recommended topics or speakers you would like to hear from? Anyone on the call? No? Okay. Let's see, I see a chat box. Hospice Giving Foundation will be doing workshops for Dia de los Muertos in October in Salinas. Oh, okay, thank you. Thank you so much for that information in the chat box they shared. So maybe that would definitely tie in to a topic of subject for October. Okay.
Ines, I have a recommendation, and I can probably help coordinate it if it's okay with you. So I think a great topic would be to just maybe bring information to the network regarding our supportive services that are offered through the CalWorks Employment Services branch. And so we do have a dedicated group out there that, you know, can come out and give a presentation on those supportive services. So some of the supportive services include like assistance with childcare, transportation, assistance with paying for some schooling, uniforms for work, and so forth.
Wow. And these are for families that are on CalWorks, correct?
Correct.
And many years ago, that was referred to as, you know, the welfare, but now it's CalWorks. So that's more the benefits branch with expanded services for those families trying to break the cycle of poverty and helping them become self-sufficient. They do have a wealth of resources that are not always utilized. So that would be a wonderful subject of topic if that's something that would interest, you know, our Cisne Forum. That's definitely something we can look into. All right. Thank you for recommending that, Yaneth. And of course, you know, we have a committee that votes on the subject. There was also a recommendation, Covered California Open Enrollment is coming usually in the fall. There was also speakers from, you know, Covered California and our local health plans that would like to speak. So that definitely also ties into the community benefits, you know, topic of resources. So we have a lot of ideas, but we can only bring one topic, so we'll have to vote, and that's why I want to just really try to bring as much information as we can to all of our agencies. As we know, the families we serve have many needs, and that's what Cisne is all about, trying to connect our agencies together and one platform to network and do referrals as needed. So with that said, I think we're going to end a little bit early, unless anyone else has any updates or like to program share. I think, yes.
I wanted to mention that one thing that came to mind is that those that are trying to integrate into that have come out from the incarceration and want to integrate into the community. Yeah, if there's anything related to that topic, that someone can share information, that would be great, because I think, they're struggling to get back into some of the programs, and especially because, there was COVID and all that.
Yeah, so like the reentry incarceration, yeah,
yes,
definitely. Maria, you have a recommendation?
Yes, I'd like to try to see if there's someone, in the forum here that would know more information or bring a presenter that can support with understanding how to assist those families that are immigrant here with children that have disabilities that are renting like these very small rooms and being also being asked to leave their home, or they become homeless and they're at high risk, and we have some of single moms out there that are struggling with that, and how to support them to understanding what's their rights, or what support systems do we have in place regarding supporting a family, even with housing or refugee systems in place for our families. Because honestly, we're experiencing that in our end, and how to support a family that's going through something like that.
Okay, Maria. So resources on families with special needs, with immigration needs, housing needs, like a special presentation on that. Thank you so much. Oh, alrighty. So that concurs our. Is there one more?
Not heavy. Thank you.
Is there one more recommendation? No. Okay. Alrighty. Thank you all for joining. This concludes our monthly Cisne Forum, and thank you for joining. See you next month. For our committee members, please stay on the line. Thank you.